Dr. Irene Ctori.
That's it, yeah.
Fantastic, from the City of University of London, who will be talking to us today about teaching empathy by simulated practice in optometry. Thank you very much.
Good afternoon, everybody. Thank you for inviting me to speak today. It's been really interesting, actually, to listen to the mix of talks from engineering and healthcare and putting it all together, which I think has been quite fascinating. I'm a lecturer in optometry. I'm an optometrist by trade, and I'm talking to you today about a project that we did. It was actually a BSc undergraduate project where we tried to improve the empathy in our undergraduate students. I've got a blank screen for a reason there. The sight of London is something that's very familiar to me. I work in London, I grew up in London, I was born in London, so I'm used to sort of seeing the skyline, seeing the London Eye, seeing Big Ben. This might not be the most familiar scene for all of you, so what I'd like you to do is come on a journey with me. Trust me, I'm an optometrist. What I'd like you to do is close your eyes for a moment. Think of a scene that's familiar to you. Is it your back garden, the view on your way to work, the view out of your office? Now imagine looking at that scene with a visual impairment. What does that now become? Has it gone blurry? Do you just see all black? Is there a blurred patch in the middle? Are the colours dulled? What does it mean to have a visual impairment? Okay, you can open your eyes now. Thank you for going along with that with me. At the end of the third year degree, at the end of the third year of the degree course, our students embark on a professional career as an optometrist. And we want them to have empathy with their patients, not all of whom will have good vision. Some patients will have very poor vision, will be visually impaired. I thought I should just explain how we teach optometry before I move on to the actual project. Optometry is the 3-year degree program. It's taught with practical sessions as well as theoretical sessions. So students sit in lecture rooms and what have you. They learn by testing each other. So they either buddy up with somebody in their class, one role plays for the other one. We teach them clinical practice skills such as contact lenses, teaching them how to examine children. And at the end of the third year, they're let loose onto the public. Okay? And we're trying to have a holistic approach to teaching these optometrists so that they are good with their sort of social skills as well as with all of their practical skills. There is research to show that empathy teaching at undergraduate level is important, and we've seen that certainly from our counterparts in medical institutions. There's been less research specifically with optometry, and I'll come on to why I think that's important in a moment. But one thing that I realised as a lecturer is that our students have limited contact with patients with low vision. So I was asking you at the start to go on this journey and imagine what it's like to have sight loss. And we're asking our students to have empathy with these patients that have a great variety of different conditions. So how do we improve that, or how can we actually expand that with our students? And that started to plant the seed of, can we use some of this high-tech technology to improve the students' understanding of different eye diseases? And the actual nugget of the idea for this project came when I was examining a student. So we do something similar to medical institutions, where we have observed structured clinical examinations. So we'll have, for example, an actor sitting there who has an eye condition, so they're pretending to have lost their sight for a reason. And the student is examining them, and it could be a symptoms and history or a communication skills station where we're sitting and listening to the student explaining to the patient what's wrong with their eyes. And in this particular instance, I was listening to a student who had to tell their patient that they were losing their sight and that it was not treatable. It was irreversible sight loss. And the student sat there, quite jolly, and said, "Don't worry, you're not going to go completely blind. You'll just lose your central vision." Looking over at me, they've done really well because they've identified the condition, but not taken into account at all what that means to the patient. You know, how is the patient feeling at this moment? So I was interested in how we're teaching empathy and what does it actually mean with our students. Do they actually understand what it means to have sight loss? So this bore the question of the research study: can we improve empathy by simulated practice? Now, of course, it's not to say that we don't already use some kind of simulation. I mentioned role play already. We teach the theory, so using our traditional sort of PowerPoint lectures. We explain, obviously, the causes of the diseases and all of that sort of thing. We do use an intervention already by way of simulation spectacles. So they're glasses that have been mocked up with blacked out lenses or little holes or sort of fogged lenses to simulate different types of vision loss. And the students have the opportunity to put these on and wander around the lab or look at the letter chart and what have you. So we already use that. Role-playing, as I mentioned, so either with use of trained actors, so that's in the third year of our teaching, or sitting with each other, so one student pretends that they're a patient with an eye condition and the other student is testing them. But we also involve service users. So we heard from one of our colleagues earlier this morning using patients with vision loss coming and talking to the students and explaining their experiences. But the question is, was that enough? You know, it seemed to me that the students were still not particularly empathetic. So I looked to a colleague who's developed a virtual reality app that actually simulates sight loss. Now, there are a number of these kinds of apps already available on the market, but there are a few issues with some of these. And Dr. Peter Jones, who couldn't be here today, so he's the technical guy. If you have technical questions, I'm going to have to ask him later at the end. He's done a lot of work with developing an app that actually uses real-life data. A lot of the simulations that you can get sort of through the sort of free apps that are available on the phone are very sort of textbooky in that they'll show a sort of a blurred patch in the middle and describe that as being central vision loss. But we know through talking to our patients and from the real-life data, that's not actually how they see. They don't see a circular black blob in the middle. Their brains will perhaps fill in the gaps, or they'll have areas of sort of blurriness or patches of loss of vision. So Peter Jones with his team has been developing an app that simulates this kind of vision loss in real-life scenarios. There's working on two different versions. So one is actually using the headset, virtual reality, or using an app on a phone, but also using augmented reality, so with a front-facing camera, so that the person wearing the bit of kit can look out and experience what it's like to have that particular eye condition, looking out at the actual world that's in front of them. This particular app is able to simulate lots of different eye conditions, so whether it be losing central vision, glare from having cataract, losing your peripheral vision, so around at the edges in conditions such as glaucoma. So I'll be able to simulate very many different conditions there. And hopefully this will work. I've got a little video clip which explains a little bit more about the app. Okay, so that was actually filmed in one of our clinical settings, so it's actually filmed at the university. And I think that was one of the important things, that it wasn't applied to, this was applied to real life, a real life environment. It wasn't a virtual environment. This was an environment that the students are working in. This is the environment that the patients are being brought into. And I hope you got a sense of, you know, this sort of blurriness with certain conditions, the difference in the colour, the glare, all of these things that we're talking about trying to simulate. Which brings us on to the project. So as an optometrist, I like numbers. I wanted to do an empirical piece of research using quantitative data. I wanted to have some numbers to prove that this thing worked. So we invited all of our third-year students to participate in this study. We have 100 or so third-year students. 44 participated in the end. We did actually give all students an opportunity to come and try out the virtual reality headset at the end of the project so that we were equitable and everybody had that experience, and I'll come on to that later as well. We tried to allocate the students into 3 groups. So we had the first group was the virtual reality intervention. The second group was using the low-tech simulation spec intervention. And the third group was kind of our control, where they had, as well as the lectures that they were all receiving, they were given a patient-facing leaflet that's produced by the Royal National Institute for the Blind, the RNIB, on a very common eye condition called age-related macular degeneration. And I'll explain what that is in a moment. The idea of the study was kind of to look at empathy levels. So we used the Jefferson scale of empathy, physician empathy. So that's a questionnaire that looks at things, asks questions like, I'm a better physician if I'm aware of my patient's feelings. And then there's a Likert scale, so you score it on very high or very low. We also used a scoring system, a visual function questionnaire that we use in low vision research, where we ask patients with low vision to fill out a questionnaire based on their activities of daily living and what sort of difficulties they have. So we'll ask questions like, I'm able to read the newspaper, I can read my own mail, and all of that sort of thing. And what we asked our students to do was to fill in this questionnaire as if they were the person with the vision loss, just to try and get a gauge of, as well as what they were feeling, so their empathy, whether they were actually appreciating what sort of difficulties this patient with vision loss might have. So all the students that took part in the study completed these questionnaires at the pre-level. The intervention was to come along and either use the virtual reality headset to read the letter charts. That was the one thing that we asked them to do. We used the one with the front-facing camera to simulate making a cup of tea. We actually had a safe environment, so because of ethical reasons, we didn't boil water. We had a jug and a plastic cup, and it was transferring water in, just to get an idea of, if I've got central vision loss, what does that mean? With both groups that either used the virtual reality or the simulation specs had to do that task. And then at the end of that period, so that took place over a matter of 2 to 3 weeks, the students all completed the questionnaires again, and we had a look at the data. We analysed the data there. So there are a number of eye conditions, as I mentioned, and we had to choose one for simplicity for the sake of this study. So I chose age-related macular degeneration, which is one of the most common causes of visual impairment in the older population. The picture there I've sort of mocked up is typical of what the students would actually see in textbooks or when you go online. When we talk about central vision loss, it's often described as a sort of blob in the middle of your vision. The problem with a static image, and that's the reason I've put up there, is that that's all very well and good when you look at it like this. But of course, as soon as you move your head away, you've not got that central vision loss in front of your vision. The virtual reality headset, as the students were looking around, that central vision loss was in front of their eyes the whole time, which is what our patients are experiencing. Interestingly, with the simulation specs, the problem is with those is that if they're not worn completely fully, and they're not designed to fit everybody in the same way, they're a standardized pair of spectacles, students could either look over them, look around them. So again, you're not getting that full appreciation of what it's like to have this constantly in front of your eyes. So what did we find in our study? I was actually quite surprised. It turned out that the students that took part in the study, their pre-intervention scores of empathy were actually already very high. So considering what I'd heard in the testing room some months prior with our students happily telling people, don't worry, you're not going to be blind, this was not a finding that I expected. So unsurprisingly, the interventions didn't really show any difference in their empathy levels according to this particular measure, to the Jefferson scale. And there were no significant differences between using the low-tech and the high-tech interventions. The other thing we had a look at was the visual function questionnaire, where we asked our students to pretend they were a patient with the sight loss and score how well they could do these activities of daily living. And the pre and the post-intervention with the virtual reality and the simulation specs didn't really show any difference. But on the whole, comparing that to data we have from real patients with vision loss, students were actually underestimating their patients' abilities. So they actually thought things were a lot worse for them than they actually were. They thought, you know, they're not able to kind of function, make a cup of tea, read their mail. And it's, you know, patients are able to do some of these tasks. The students just really didn't have a grasp of what that actually was. We had a relatively small sample, so I'm not entirely sure what we can realistically or meaningfully draw from this. We've heard from some studies this afternoon where the sample size was actually a lot smaller, so I think 44 was actually not too bad. But I think we sort of took it on the face of it was a pilot study. We're sort of exploring the field, and this is something that if you have ideas to share later, that would be great to hear from you on where to take this going forward. I think there's an issue with using empathy scales, and that's something I've heard from colleagues in these sessions earlier, that you know, what are we actually measuring here? I think it would have been better to have taken some qualitative data, because certainly speaking to the students that took part in the study, they all felt that they were far more engaged with the actual module of this low vision module. They felt they had a better understanding, even though on the measuring, on the empathy scale, it didn't show up. And I think there is definitely scope for this to be, for the virtual reality to be incorporated in the teaching. I think I need to find a way kind of to prove how it works to attract the funding for it. I said, interestingly, why is it different for optometry students? We've heard a lot of, you know, with virtual reality, we're trying to sort of walk in somebody else's shoes, experience the world how they're experiencing it. But if we actually think about it, we're using our eyes, and this is a virtual reality app that shows you how it might be to actually see through somebody else's eyes. And I think it's quite fascinating that it's something that actually hasn't already been tapped into in optometry teaching, and that's something that I'd really like to take forward. Brings me to the end of my talk, I think, with a few minutes to spare. If you have any ideas for how to take this forward, or work that you've done that you'd like to share, I'd really welcome that, as well as any questions that you may have.
Well, thank you very much indeed, Tori. I don't know about everybody else, but that's, to my mind, a perfect example of VR in teaching. So thank you very much indeed for that talk. Is there any questions?
It's not a question, but it's kind of, I'm just looking at some quantitative, we're presenting that, we looked at everything, we're not presenting the quantitative data today, but we also did find a shift, or we actually found a slight decrease. It was nearly significant, but I'm just trying to see whether or not our students are at a high level as well, as we did the context students. But, so I wonder whether perhaps, I think they did, I think so their empathy scores were quite hard to start with as well.
Yeah.
I think maybe perhaps they're not necessarily adept at translating that into behaviours that you know, that's kind of the challenge, isn't it? So I don't know whether that's kind of one of the next things to sort of look at.
Yeah, I think that's really interesting. So the comment, I think I need to repeat back the question. The comment is that from a similar study, your empathy levels in a different context were also high. But how to, you know, are we just looking at I'm wondering if the measuring scale perhaps isn't the right thing. The other thing that's occurred to me is that as soon as you call it an empathy questionnaire, they're medical students, optometry students, healthcare students, they're not very likely, and I think I'd say it was quite easy to sort of score highly on those to come across as being empathetic. So my idea is actually to look at measuring their communication. We already use simulated patients or standardized patients, and that's one of the things that was one of the stations that I was observing when I heard this student saying, "Don't worry, you won't go blind." And I was wondering, actually, by using some of these interventions, if it's their communication which improves, not necessarily their empathy, because I think with all the best will in the world, that they want to be empathetic, it's just perhaps not coming across. Thank you.
Any further questions?
I just would like to back up what the lady there has said. I looked at a range of different empathy scales when I did mine, and there's different ways of measuring empathy. Do you measure empathy as a person, or do you measure empathy as a professional? Because most of our students can come in and give you the right answer. Yes, I'm very caring, and all of these things. But as you say, it's that, how do we get that translation from being theoretically caring into actual behaviours? I think it's really interesting, and I think maybe it's about testing the behaviours rather than statements, I suppose.
Yeah, I agree. So the comment is, how do we translate the empathy questionnaires into behaviours? The next step of this, so as well as using VR in education, in higher education, the next step of this particular project as well is to actually use it in the public domain. So I'm interested actually in using it with carers. So the patients have the condition, but it's the people, their carers. If they don't have an understanding of what this patient is going through, now that's used across healthcare. But I was thinking with sight loss, it's very hard to imagine. You sort of, the immediate thing you do is shut your eyes, or you sort of think about things being blurry. But actually, try making a cup of tea or whatever using the headset. So the idea is to sort of change the focus onto the users and carers. But then I think the two could go hand in hand, because then it's all about that perception of that sort of the behavioural thing, using that to inform the teaching as well, and how the two go together.
A life-changing diagnosis.
Yeah, the emotional impact of, absolutely. Thank you. Yes.
So when you run the experiment, how long did they have to wear the headset for to be in that situation with the patient where they had
So the question is, how long did they wear the virtual reality headset for? It was no longer than 5 to 10 minutes, so the amount of time you'd have your patient in a chair doing the initial sight examination. So at the during a sight examination, we take history and symptoms, and then typically move on to trying to measure vision with a standard letter chart. So that's the kind of conditions that we tried to mimic. It wasn't any longer, and if we're going to do this project again, I think we need to have more control over how long they spend doing each task, so that it becomes more, so that there's some kind of control on it. So I think that's a good comment. Thank you.
Personally, I think if I put a headset for 5 minutes, the impact of that for me would be quite different, say, if I had to wear it for half an hour to an hour in terms of actually trying to do other things with that impairment. And so I can personally see that might happen.
The comment is wearing it for 5 minutes perhaps won't be as impactful as wearing it for longer. The original ethical application we put forward was that we wanted to take the student wearing the virtual reality headset for a walk around the university. The ethics committee were not so happy with that. And to be honest, because it was an undergraduate study, we had a time frame, so I was conscious of not delaying getting the ethics through for the sake of the student, because suddenly, it's not a year, it's sort of 4 or 5 months that we're trying to do the project in. But that is something, again, going forward, now that we've kind of got the pilot study and got some data to show for it, that we'll take forward. Thank you.
Anybody else? I actually have a question, and I apologise about this question now. I'm an engineer, not from the medical side. Your study was on empathy, which I completely understand. I like your talk very much because it's relating using VR in a teaching aspect, which I thought was great. From an engineering point of view, did you feel that the students, apart from the empathy side, which is what you're looking for, my side would be, did they actually learn that different conditions have very distinct, different problems for the eye, and were they made more aware of that because of the virtual reality things are just learning it in a book? Do you think that being immersed in it made them understand more what the conditions are?
Definitely. So anecdotally, so just talking to the students, yes, so the question is, did the students feel that they got more out of being in an immersive environment? Definitely, because like I showed you with the 2D picture with the blob in the middle, I can recreate that with the outside blurred, but what does that actually translate to? When you put on the headset and you look around, it becomes more real. And of course, if we're using it in a virtual reality environment, then we can submerge that in, it could be your local shopping centre, it could be your sports hall, so it becomes real to that person. So yeah, I didn't collect any qualitative data on that, but certainly from what the students were telling us, they really, really liked it, and they felt that it had some place in the curriculum.
That's great. I'm an engineer, I'm not empathic, so it's fine. Any further questions? Well, I'd just like to take this opportunity to thank Dr. Ctori for